My name is Julie Kramer. I'm a registered dietitian and I have a master's in science, but I focus on holistic nutrition. So I'm a nutritionist and I work one-on-one with people to help make lifestyle changes. I came here because I lived in the community, and I live in the community and I do other work in the community, and I thought it was wonderful to have a holistic center where we can help our own people in our town. Well, in terms of nutrition, how I see it playing a role is that people generally know what to do, or they think they know what to do, but with all the misinformation out there regarding nutrition, it's important to try to tease it out for them, because we are a food-phobic society. And what my goal is to take each individual where they are. So maybe I'll have someone come in who is a vegetarian and they want to be a vegan, or maybe I'll have someone who come in who's having 3 Diet Cokes a day and, you know, eating McDonald's. I meet the person where they are and I help them make sustainable change. And that's my focus in terms of being holistic, is how does one really create change? So what I have found in the past 18 years of practicing is that if you could focus on the individual's lifestyle and where they are in the current moment, you can devise a plan that helps them become more able to achieve the goals. So what we do is, which I find very helpful, and it helps us, you know, help the clients be more successful in the long run, is that we'll round on patients. So if I'm sharing a patient with someone, every once in a while we get together, we'll discuss the patient, we get to hear how that person is treating. Let's say recently I have a patient who's on cholesterol medication, and she's made huge strides in nutrition, but I need to go to Christine, the PA, to say, let's talk about, you know, discontinuing her cholesterol meds. Where if I was working in my own home, I couldn't necessarily have that integrative approach of having the benefit of having someone to actually discontinue a medicine, which is invaluable for the client. Very positive, because they feel cared for. So it's not just that one part of them is being treated, that they know that there is conversation being had, and that the team approach feels, I think, settling to them. Well, that comes down to the individualized approach. You really have to understand everyone's story, where they've come from, how they eat, what their lifestyle is like, because when you listen to that, you could create a plan that's, you know, successful for that individual. Because if you just throw a one plan on everyone, if everyone comes in for weight loss and I'm telling everyone the same thing to do, it's not going to work. You have to hear their story and how they grew up and what their lifestyle is, and do they travel, and how many times are they eating out, and at the same time help them identify restaurants in their neighborhood or how to read a menu. You know, feeling comfortable and developing a relationship with someone and connecting to a person, you're more likely to follow out with your goals and to know that a person is available for them. For instance, I might see someone in the office for an hour, but they have access to me via email 7 days a week, and they could text me. So if they're in the supermarket and they want to know, is this a product? If I have my phone and I can answer it, I'll answer the question. But I want them to know that, you know, we are available for them. Because in order for them to be successful long term, they need access to us. I had a child who was she had kidney issues, and she was on prednisone. And I think she was on it for about 2 years. And I was working with a doctor in the office, Dr. Kakai, and we were between acupuncture and between putting her on an anti-inflammatory diet, we were able to wean her off the prednisone, which is a godsend to get someone off of prednisone. I think that's the hardest drug to get someone off, one of the hardest drugs. So she's completely off her prednisone a year earlier than she was supposed to be. So that was very exciting. Another client I had, she had severe GI issues, and where it was really impacting, you know, her daily life, because if she was not near a toilet and felt comfortable to use the toilet, you know, she would have a lot of issues, and you can imagine. And through an anti-inflammatory diet as well, meaning no gluten, no dairy, she was able to decrease her symptoms, decrease the movements, decrease the bloating, the pain, and feeling much better about her everyday lifestyle. So that's invaluable as well. Well, I think it's the individualized approach that's really important to help someone be successful, and also the fact that you're working with other practitioners, because it's generally, if you're coming to see me, let's say you have nutrition issues, but there's also GI meds that you might be on, I can work with the doctor to help get the person off the meds, and at the same time I could be working with the diet. So not many offices have this integrative approach where more than one person is involved in treating the person with different specialties. You know, I hope that through rounding on patients and through communicating and collaborating, patients can get off their medications. Patients can have a better quality of life. They enjoy more, and that they really are able to instill the lessons that we teach them, because there is so much support here.